Hi, Dr. Ramsey Choucair. I'm a board-certified plastic surgeon in Dallas, Texas, and we're doing a short series on safety in plastic surgery, which is maybe a short series, but probably the most important series we would ever do. Because really, any plastic surgeon, board-certified, who does aesthetic or cosmetic surgery is foremost thinking about the safety of his patient. These are elective procedures. We have to keep that in mind. And today we're going to briefly discuss the most current rage, which is buttock augmentation. And I'm sure many of you may have read that there have been many complications from buttock augmentation. And it can come in the form of two ways. You can augment a buttock through an implant inside or beneath the buttock muscle, or you can inject the patient's own fat to augment the buttock. Now, we're not even making a comment about whether that's aesthetically pleasing or not. Many of us plastic surgeons think that whole buttock augmentation trend has gone way too far. And we all know the societal Instagram posts that make headlines and make people think that a fuller, larger buttock is a good thing. But you have to remember that even if your aesthetics are such, as time goes by and aging progressive, things are going to change. And we don't know what's going to happen when you put that much fat in a buttock and then the buttock ages 20 years later. So most of us plastic surgeons who are a little concerned about that do limited buttock augmentation in patients who simply need it because they've lost some of the fullness. Where does the safety thing come in? Well, anytime you put fat in the buttock, you're putting fat in an area where there are blood vessels. And if you inject fat in a large blood vessel, primarily beneath the muscle, which is something that our society has already stated is a bad thing and very unsafe, then you could inject fat into one of the larger veins or arteries. It could go to your lung, and you could be very sick, or you could unfortunately die. And those things have happened. So my takeaway from this is, first of all, buttock augmentation may be appropriate in some patients who've lost volume or who want a slightly larger buttock, but large volume buttock augmentation with fat is a treacherous operation in many cases. And I only say this for you to go into it with eyes wide open, be cautious, and make sure you're seeing a board-certified plastic surgeon who you believe has your best interest at heart and is most focused on safety, because buttock augmentation with fat can be a very dangerous procedure in the wrong hands. So I hope this helps put it in perspective, and if you have questions, make sure you see a board-certified plastic surgeon.